Well, good morning, good afternoon, and good evening, wherever you are, and welcome to UW-Madison's Global Health Institute's first Global Health Tuesday webinar for 2025. Thank you all for joining us. My name is Jorge Osorio, and I'm the director of the Global Health Institute, and today we will explore the importance of building indigenous trust and partnerships for health. Our monthly Global Health webinar series features researchers and practitioners from the University of Wisconsin-Madison and around the world to highlight and examine the complexity of global health challenges and the many kinds of expertise that are needed to address them. Our work is rooted in the Wisconsin idea, a practice which takes knowledge and research out of the classrooms and into real-world settings. At GHI, we are conveners who believe addressing global health begins with investing in community-level conversations. We foster collaborative One Health-focused discussions that connect human, animals, and plant health to transform global health perspectives through multidisciplinary and multisectoral approaches. Today's discussion will explore the importance of investing time in understanding community needs, views, and traditions in order to be fully aware, engaged, and present when looking for community health solutions. We will learn about the relationship between the Sokaogon, Chippewa Community Moore Lake Band of Lake Superior, Chippewa, and UW-Wisconsin-Madison. But before we jump in, a couple of quick housekeeping items. We are recording today's session, and the archive video will be available on our website at ghi.wisc.edu. And second, we are monitoring the chat, so please share your questions and comments for the panelists there as well. So we have a great panel, and I'm very excited about our webinar for today, so let's get started. Today, we begin by welcoming our moderator, Carla Vigue. Carla is the director of the Tribal Relations at UW-Madison and a citizen of the Oneida Nation. She focuses on building and nurturing relationships within the Native nations of Wisconsin and the organizations and entities created by tribal nations and communities. As director, Carla leads the university's initiatives, strategic engagement opportunities, and special projects with tribal nations and affiliated organizations. Before joining UW-Madison, Carla's experience included advocacy and public health relationships on behalf of the Native nations in Washington, D.C. And also, in addition, she worked for the governor's state of Wisconsin. She also spent over a decade doing public affairs work at various Wisconsin state agencies. So, Carla, thank you for joining us and welcome to our webinar.
Thank you.
We also welcome Caleb McGeshick. Caleb is Councilman second for the Sokaogon Chippewa community and a proud native of the Moore Lake. He brings a deep connection and unwavering dedication to his community. With roots in tribal maintenance, Caleb has long served the Sokaogon Chippewa community, now contributing as co-chair for the partnership between the tribe and UW-Madison. His leadership focuses on fostering collaborations and advancing opportunities for the community. Caleb, thank you so much for joining us, and also welcome to our webinar.
Thank you.
Next, we welcome Jason Neilitz. Jason is Chief Information Officer for the Sokaogon Chippewa community and a seasoned executive with over 20 years of leadership experience in technology, travel enterprises, agriculture, and construction services. Jason oversees IT operations across 20 tribal departments, driving innovation, efficiency, and cybersecurity. He has established governance frameworks and proactive support systems, ensuring secure, optimized technology solutions for the organization. Jason is also a recognized thought leader, serving the Governor's Digital Summit Board and the State of Wisconsin Cybersecurity Subcommittee. Jason, also welcome to our webinar. Thank you for joining us.
Thank you.
We welcome Kurt Zimmerman. Kurt is the Senior Director of Biohealth Industry Partnerships and leads industry engagement for the School of Medicine and Public Health at UW-Madison. Kurt's portfolio includes management of conflict of interest for physicians and faculty and collaborations with UW-Madison's academic health system, UW Health, and support of medical innovations. Kerr also serves as the director of the Masters of Science in Biotechnology program at UW-Madison, a cross-disciplinary program with nearly 500 alumni and students working across the biotechnology industry. Kurt, also thank you for joining us and welcome to our webinar.
Thank you.
And finally, we welcome Lauren Yowelunh McLester-Davis. Lauren is the director of the Indigenous Science Advisory for the Native American Center for Health Professions at the University of Wisconsin School of Medicine and Public Health, and works with their tribal engagement office. Lauren engages youth in science, education, and leads capacity building efforts to support tribal institutional review boards, data sovereignty, and research engagement with Wisconsin tribal nations. She also has a scientist appointment in the Alzheimer's Disease Research Center and in Dr. Judy Simcox's lab in the Department of Biochemistry. She also serves on the board of directors for the Society of Advancement of Chicanos and Hispanics and Native Americans in Science, and chairs their Native American Indigenous Affairs Committee. Lauren is enrolled as an enrolled member of the Oneida Nation. So thank you so much, Lauren, for joining us, and welcome everyone to our webinar.
Thanks for having us, Jorge.
Thank you. So now I'd like to hand our conversation to Carla, who will moderate our discussion. Thank you.
Thank you, Jorge. And good morning, everyone. Thank you for joining us here today. Today we're here to talk about a collaboration between the Sokaogon Chippewa community and UW-Madison. As Jorge said, I am Carla Vigue, and I'm the Director of Tribal Relations here at UW-Madison. And I play a small part in this initiative that we are about to discuss with you today. I'm not going to try and steal anyone's thunder, but I'd like to share a little bit about what we plan to discuss, how we got here and where we are, and why it's important. So let me start. I don't know exactly who's on this webinar, but I'd like to start kind of at the beginning. So for those of you who don't know much about Native nations, Wisconsin is home to 11 federally recognized Native nations. As Jorge said, I'm a citizen of the Oneida Nation, and Oneida is one of those 11 tribes here in Wisconsin, near Green Bay, Wisconsin, home of the Green Bay Packers. In the United States, there are 574 federally recognized Native nations. You might have heard them called by other names such as tribes, nations, bands, pueblos, communities, native villages. But the important thing is that each nation is a sovereign with its own land, its own government, its own citizenship, and its own culture and history. And this is where we're starting, because when I say, let's go back to the beginning and talk about why what we're talking about today is important, let's just start there. How did we get here? So I'm estimating, but just over a year ago, Jason Neilitz, who works for the Sokaogon, heard about a biotech grant that we, the UW, had received and reached out to learn more. Because the Sokaogon, like just about any other community, has health disparities and mental health concerns in their community that they wanted to address. And they were exploring options and opportunities, and they wanted to reach out and see how we could work together. And from there, we began to build a relationship. And so today's discussion is titled Building Indigenous Trust and Partnerships for Health. And that's because we want to share our experience in developing what we think can be a successful partnership. And you're probably wondering, well, so why does that warrant a discussion? And I think Dr. McLester-Davis may touch on this, but a relationship between a university and a tribal nation is unique. There is an incredible long history of distrust between tribes and universities. And when we think about academics or researchers and tribal leaders and culture keepers, we are talking about very different ways of thinking about our communities, our culture, our information, our stories, and the things that are important to us. But that said, there is a renewed commitment on the part of some universities like UW-Madison to ensure that we build strong collaboration and collaborative relationships with tribes. So let me share a few slides. So this first slide here, slide 1, is partly just me being a mom because I'm a mom, and those 2 boys in this canoe here are my boys, and I think they look adorable. This is a birch bark canoe, and but I don't share it just because they're my boys, but I also share it because this represents a very important aspect of our university. My boys are here in a birch bark canoe that was built by a Ojibwe birch bark canoe maker, Wayne Valier, who was in that canoe with them. But UW-Madison is built on the ancestral homeland of the Ho-Chunk Nation. And the lake that this canoe is on is part of our campus. And the Ho-Chunk call the lakes that surround our campus Tejope. It's a 4-lake area. That's also ancestral Ho-Chunk land. And the Ho-Chunk Nation was forcibly removed from this area. And if you look, we can't look and see, that's a mistake. But just beyond this tree line, behind my boys here, ancient dugout canoes, Ho-Chunk canoes were found, thousands of years old. And they were found in this lake. And so this land that we're on is, ancestral Ho-Chunk land that natives lived on and had families on and had community on and hunted, fished, survived. And so I think just going back, thinking about our university as a whole, the history of our university, this is really important. So slide 2, please. So we've come to acknowledge this history and the land that we took from the Ho-Chunk people. And over time, partly out of this recognition and partly out of just doing what's right, the university came to establish the Director of Tribal Relations position, and that's me. And so you'll see here, this is from one of our early meetings. In the middle there in the red jacket is our chancellor, because there has to be a commitment from the top down to partnerships and relationships with the tribes that are collaborative, that there's a foundation of mutual benefit and trust, and that, we work together, that we aren't, coming in and telling people what to do, but rather working collaboratively, working in tandem and listening to one another. And that's why we've established the Director of Tribal Relations position here at UW-Madison, so that from the highest level of leadership down, we have this kind of new way of thinking about how we work with tribes. So that's, what we're trying to do here. Slide 3. And so it's more than just acknowledging history with words. And so we also want to celebrate and share that history. And so across campus, we do that in many ways. And some of those ways are visual. And so these are just a few of the places on campus where we've done that with, we've built a Chippewa. We've got some other places on campus with artwork and things like that. And I just thought, for those of you who aren't as familiar with UW-Madison, I just wanted to share those places with you. Next slide. Of course, within all of this, students are at the core of everything we do. So, Chancellor and I have met many times with tribal leaders, elected tribal leaders, and others in the community, and their priority is always the students and ensuring a strong relationship with those people and the students is making sure that students feel like they belong, like they have a strong supportive community, and providing them the tools they need to succeed is what matters most to people. And so that's another thing that we really focus on here at UW-Madison. And I think you'll hear from Dr. McLester-Davis later, and I think part of one of those things is having Native faculty and staff who, like Dr. McLester-Davis, are able to interact with those students. So that's one of the things we are also working on here. And so when we're talking about these relationships between tribes and the university, that's another important aspect to it. So next slide, please. So back to the Sokaogon Chippewa. So I shared a little bit of what happened. So again, the Sokaogon CIO sees that we are a biotech hub and reaches out. And I've shared that the university has committed to a collaborative relationship with the tribes. And in fact, as this slide shows, we work with many tribes across the state oh, I'm sorry, I've skipped a slide. This is actually, I'm sorry. This is our Native American Center for Health Professions. And I just wanted to share this one also because this is a large group of Native faculty, staff, and students who work in our health professions. It's an amazing group of people. These students also go out into tribal clinics and do a lot of really good work in those Native nations that I mentioned earlier. So I'm sorry, I skipped this slide. But next slide. Okay, so again, back to the Sokaogon Chippewa. CIO reaches out, sees that we're a biotech hub, and I've shared that we are committed to a collaborative relationship with the tribes. And in fact, this slide shows that we work with many tribes across the state on a wide variety of projects. This is just a few examples, but again, each tribe is a sovereign nation with its own land, its own government, its own citizenship, its own culture and history. And as I said, each relationship between the university and each tribal nation is unique. And so with that, I'm going to open up the discussion to others so that we can talk about this particular relationship with the Sokaogon. And I'm going to introduce our guests from the Sokaogon Chippewa community. I'd like to introduce Councilman McGeshick and CIO Neilitz, who can tell us a little bit more about the Sokaogon Chippewa community, what their health outcome goals are, and what we have accomplished thus far.
Thank you, Carla. Do we have our slides available? Jason?
Sure. Yes, I'm about to share them. Sorry, only one person can share at a time.
That's fine. Thanks, Kurt.
There you go. Do you see it, Caleb?
Yes. So I'll start off. On the left here is when we is a second visit? Second visit. Yes, when we went down to our second time visiting the UW Madison school, and they gave us a tour, a lot of great discussion. They fed us. The bonding that was happening, the face to face. Anything I'm missing on this slide, Jason?
And then the next one was at the community center.
Yes, on the right was at our tribal community center. So where we hold ceremonies and stuff like that. UW came up here and we continued our discussion on our working relationship. Next slide, please. In this picture, we have our chairman, Robert Van Zyl, and in the background, we have our rice lake where we gather and harvest rice in August. We established a working group. I'm also the co-chair of the working group, along with Kurt Zimmerman. The goals and outcomes, Jason, if you can touch up on some of our goals.
Sure. One of the goals, the Sokaogon Chippewa was and is in the middle of a clinic expansion, right? Which forced them to get creative, right? And in reviewing and having discussions with UW Madison, right, it was apparent that over the next decade, specifically in the state of Wisconsin, there's going to be a 7,000 to 10,000 shortage in medical staff, right? Which is going to put a very big burden on rural healthcare, more specific, clinics in tribal country. So what we wanted to do was utilize technology to bridge that gap. Right now, the Sokaogon Chippewa are pursuing efforts to go after broadband through the federal and state governments to be able to bring broadband to the homes of the tribal member and non-tribal member in the area that the Sokaogon Chippewa serve. And what's important about that is once you bring that internet connection, because as some of you may or may not know, in rural Wisconsin, specifically in Forest County, in our region, more than half of the homes are unfunded and unserved, which means that they don't have, reliable internet connections, which degrades everything from economic development to recruiting people for people to come up here and be able to work from home, or the services that a lot of people in urban areas, enjoy. So one of the biggest things that the Sokaogon is looking at is creating that infrastructure. But then once you create that infrastructure, you have to have a partner, which is UW-Madison, to be able to bring, telehealth services, distance learning, right? Those types of things right to the homes of tribal and non-tribal members. So the stress of creating that relationship now, rather than waiting for the problem to arise, is the council's vision. And I think one very critical and important thing to note is that the tribal council created this vision and supports this 100%, right? That's one of the most important things, actually the most important thing from this side, is that the 6 tribal members support the partnership, the infrastructure build out, and bringing services to the homes of tribal member and non-tribal member on or off the reservation, right? And they support those initiatives 100%. So it's important to know that. Some of the other objectives that they want, to pursue, is internships, right? Like having the School of Medicine and Public Health, and having that relationship with them to be able to offer internships in the Sokaogon Chippewa clinic expansion, right? Bringing more advanced knowledge and people to the area. And once they have an internship there, they might come to an agreement and offer full-time services, to that area. The other thing in regards to bridging the gap, again, is creating the distance education, right? And UW-Madison, in my opinion, is one of the best in the Midwest in offering that education, right? So the tribal membership that wants to advance their career or expand their horizons, eventually we will be able to have that right in your home and be able to bring that service, to the tribal youth and to the elders.
Thanks, Jason. On this next slide is a list of our working group. So myself, the co-chair, along with Kurt, and we have UW-Madison and Sokaogon Chippewa community. Next slide, please. So the goals of the collaboration. So Jason, would you like to start?
Sure. Sure. Some of the goals, again, are, education and telehealth specifically, and really embrace the local community. The Sokaogon Chippewa Tribal Council has established a very strong relationship with Forest County, the board of directors there. Chris Schaefer, who's been a key member there, Ron Scaller, who is. So the Sokaogon Chippewa understand the effects of collaboration, right? Like the chairman said, prior to any of this development, is instead of working against, right, the colleges and the state and the counties and the townships, let's figure out ways to reach across the aisle and actually sit down and have a discussion, because we're stronger together than we are divided. And really, it's this council that supports that from top to bottom. They have a relationship with Forest County. They have a relationship with Florence County. They have a relationship, a positive relationship with the townships that border the reservation, right? And you have to have that prior to bringing, some of this advancements, on. And that's one of the importance and the stresses of UW-Madison. Was UW-Madison and their staff, Kurt and Carla and Dr. Lauren, really embraced, this relationship so much that they actually came and did several visits, right? They did a four-wheeler ride through the reservation and the mine site. They actually sat down with some of the elders in the community to be able to hear what their concerns were, right? And instead of rushing everything, it's been a slow, methodical process, but that's how you build trust, and that's really how you build long-standing relationships, specifically in tribal country.
Thanks, Jason. Okay. Next slide, please. So here's our timeline from when we first started. As Carla touched up on it, Jason reached out back in October of 23. And we went from there to moving forward to April 24. UW meets virtually, and we discuss the possibilities of clinical research. Then we move on to May of 24. The whole council, and that consists of 6 of us for Sokaogon Chippewa here, the 4 exec members and the 2 council members. We made a trip down to UW for the first time. July, our working group continues, and we're at this point where UW had made a couple trips up here. September 24, we visit Madison, had a tour. It was great, the face-to-face, the information that was shared from the UW school, the tour, everybody willing to participate, and it was a good day. Next slide, please. So if you look to the very left, you'll see some side-by-sides. You got Kurt, Paul, myself, and believe that's Leland. But we gave them a tour of our mine site that we had to purchase years ago. I want to say it was like a 27-year battle to get our land back, to stop the mine, the Crandon mine. The next slide, we have our chairman talking to a couple UW staff at our community center. And the next slide, the third one, hugging Mabel, is that's what we do. We gotta come together face to face, bond with each other, get to know one another. That's the only thing, that's the key to a healthy relationship. And the very last one, we have a tribal elder who was a cook for our lovely UW staff that came up and enjoyed a meal with us. Next slide, please.
Before we move on, Caleb, can I just add 1 or 2 things about this visit to Mole
Yes,
Lake?
please do.
Because this was really an extremely important visit for us. We were invited, a delegation from UW-Madison was invited by the Sokaogon Tribal Council to spend 2 days with them, learning about the community, really experiencing the environment, and being engaged in real discussion about the health issues they face, and really the council's vision for the well-being of their community, and how a collaboration with UW-Madison could really be a model, not just for the Sokaogon, but for others. And one of the things, if you look at all these pictures, each one represents some form of dialogue, right? In all of them, including the one to the far right when we eat, because we're always hosted extremely generously at Mole Lake. So I wanted to make sure that picture got credit. But at the conclusion of this 2-day meeting, it is when the council charged the working group that they wanted to move forward with very specific objectives to really formalize this partnership and move forward. And I think when we were driving home from Mole Lake, I remember in our car talking specifically as we were reflecting on those days, just the reality of the privilege of the invitation, of being invited into this community to learn more. It really was a privilege, and it was, as someone who's lived in Wisconsin almost my entire life, there was so much that I learned. And it really, I think, the potential for this partnership was really highlighted there. And again, as always, it's a wonderful, wonderful visit to Mole Lake. but I'll move
I'll
on.
I'll
Oh,
add on to that, Kurt. As you know, the director of tribal relations, Kurt, reached out to me when he first started the dialogue with Jason, and this invitation came, and I was really happy that that this large group was able to commit to spending this time at Mole Lake, because this is how you build a relationship with a tribal community. And I think, and when I mentioned at the outset, that this is a unique opportunity, or this is a unique way of building a partnership. Um, you know, Most people don't spend 2 days just getting to know each other before they even talk business, right? So most people don't go out and go on UTVs and roll through mud and and eat fried fish together, and it was wonderful. It was a really wonderful time, and the hospitality was amazing. And then we sat down and really talked about what are we going to do together, and I think that's really really important. And it was a great visit, and it's a really strong foundation for everything else that followed.
Thank you, Kurt and Carla. Um, Feel free to, if I leave
yep.
anything out, feel free to jump in and, uh, thank you. If you look to the left, it's Jason, myself, and Councilman Leland. We took a picture with I want to say Bucky is his name, right? Bucky the Badger. That was a great day after our first visit down in Madison. After the discussion was over and we got to walk around down by the pier, take some pictures. As you can see, majority of the council is in the center. I actually stepped out, and if you look to the right, we got the chairman and our treasurer. She stepped out, just why we missed out on a center picture. But each visit that we go down to Madison and Madison comes up to Mole Lake, it's words can't describe it. It's fun. The relationship building is, I look forward to each visit that we go down there and they come up here. Next slide,
And
please.
I just one more thing I'll add on this visit, Caleb.
Yes.
As Carla mentioned, a lot of this dialogue started when Wisconsin earned designation as one of only 12 regional technology hubs in the United States. The federal government designated Wisconsin in the area of personalized medicine. And it's very gratifying that both the School of Medicine and Public Health and the Medical College of Wisconsin, as the state's two medical schools, really formed the foundation of what was an unprecedented economic development opportunity for Wisconsin. $49 million, and we've never competed for economic development money at that level. We chose personalized medicine because everywhere there is a person, there can be an impact. And when Jason reached out, I think it was extremely important that they saw the potential to engage in that and really, through collaboration, elevate the health and the well-being of their community. And this visit in particular, when the SCC Council visited UW-Madison, as I understand it, as we've been told, it was the first time in UW-Madison's history that a full tribal council had been hosted at UW, and that we did so with the intent to discuss clinical research, health data sharing, a lot of those things. And we actually signed an MOU out of this visit and have begun some projects there. Was really gratifying and really a wonderful, wonderful, again, I can't emphasize dialogue enough. That really has been the key here. And I think our rule of thumb has been, just in our working group and in these visits, everyone is welcome at the table. You can be a skeptic and be welcome at the table. We welcome the skeptics because it makes us even stronger. But if the table gets crowded, we get a bigger table, right? So, but this was really a wonderful visit. And yes, they were able to visit with local dignitaries, including Bucky Badger and the chancellor. But Bucky seemed to be the one they were most interested in. But this was really a wonderful, again, opportunity for information sharing.
Yes, thank you, Kurt. On this day, we did our groundbreaking for our clinic expansion, drum ceremony, flag bearing. If you look on the left is myself, Leland, and Dr. Lauren. In the center here, we have Jason's brother. He served in the Army, yes. And then on the right, we had our full council take a picture with our groundbreaking. Would you like to touch up a little bit more?
I think it was really important, and it really strengthened the relationship. When an invite was sent out to UW for this on a last second notice, right? Because it was dependent on weather, it was dependent on other things, and they sent individuals, right? Dr. Lauren, Kurt, and if I'm missing anyone, please throw that out there. But they helped to fortify the relationship by showing up, right? Not sending a letter, right? Not sending another representative or a phone call. They actually made the hike up from Madison to participate in this historic event, and the council really appreciated that, right? And so it's sometimes the little gestures and the little things that really transform into the relationship building. And I wanted to stress that.
Yes.
I just want to add and chime in, Lauren. You're being awfully quiet, but this was just such an awesome day. This was so much fun. I mean, I feel like fun isn't the right term because it was a really meaningful, but I just loved every second of it because so much about the community's values, so much about what the community feels is important and wanted to publicly in a community forum represent was so evident that day. And again, for me, some of it was new in terms of what I saw, but it was just again the bridging of the council and the community and welcoming us in. It was a really wonderful day. The clinic expansion is a huge opportunity, and one of the things I remember is at the community meal that followed the ceremony, talking with people, members of the regional community, not members of the Sokaogon, but members of the community who came to celebrate this because they really felt it was going to be an opportunity for regionally individuals to do more with the Sokaogon and the impact this clinic could even have on those outside of the tribal community. But again, the opportunity to be there, the invitation was so welcomed because the drum circle. And again, I wanted to make sure we acknowledged such an important part of the ceremony was the recognition of veterans within the Sokaogon. And it was just a really spectacular day, again, which advanced really important dialogue. Lauren, do you have anything you want to add?
Yeah, I think Councilmember McGeshick is doing a great overview of our timeline and creating this relationship. I think one thing that the University of Wisconsin individuals who have been participating in this working group have done a really good job on is recognizing that we are not from the community and really needing to understand what living in this community looks like. And it was a huge celebration. I was so honored to be there because expanding the clinic services at Sokaogon is a really great opportunity, not only for the tribe, but their clinic also serves the regional community. And so it was just a really great celebration to be able to see that network building and that service being offered, and the tribe being able to open a new portion of their clinic and serve more people is going to be such a great thing that has come out of this current tribal council. I'll pass it back over to Councilmember McGeshick.
Thank you, Dr. Lauren. Next slide, please, Kurt. So if you look to the left, this is Kurt and myself and the side by side when we had a great time. I did not want to get muddy that day. If you guys remember, I had white pants on.
You had white pants on. I remember that.
That was a great time.
I was sitting in the back seat and Caleb was not as concerned about how dirty I got. But that's all right.
Yeah, I just wanted to stay clean. Those were my favorite pants. The next we have our health fair that we invited the UW to come up, and we have Christy and Mabel that came up to the community and enjoyed the day with us. They had some raffles that they gave away. The community, this was the time for the community to ask questions and miss anything, Jason? I mean, it was another fun time. Every time that we go down there, they come up here. It's always a great time. They did have a little, if you see, there's a little bitty wheel. There's a Q&A for, I don't even know how to say it, but Lauren, did you make it up for the health fair at that time?
Not
Last year?
this time, but the next one. And I
Mhm.
think I just wanted to jump in and add that, one thing that has been really awesome for me as a researcher at UW has been able to work with Sokaogon, because one thing I always say is if you've worked with one tribal community, you've worked with that one tribal community. So even though we're sharing information about this partnership, some of these things are not going to apply, but a lot of what has been said in terms of creating a good dialogue and having consistency in your relationship definitely applies as, that goes towards any good research partnership.
Yes, thank you, Doctor. Would you like to add something, Jason?
I think what I want to do is make the chairman made a statement early on in the discussions, and I just wanted to share that with everyone. He stated that we have to take a proactive approach for the health, welfare, and safety of our people and grow from the inside out, he asserted. We need to integrate traditional medicine and contemporary pharmaceuticals with a holistic approach. And who better to partner with than UW, the School of Medicine and Public Health and the Medical College. On paper, everything, looks as though it should develop and be embraced. But when you really break it down to the people on both sides of the aisle, I'm grateful to be part of this, right? And how the people on both sides really embrace and really share that vision from top to bottom is really a neat thing to be part of. I just wanted to share that.
Thanks, Jason. Next slide, Kurt.
I would just very quickly here, I can chime in. I just wanted to make sure everyone had access to URLs to learn more about the parties here, but I really want to acknowledge the Native American Center for Health Professions in the School of Medicine and Public Health. Lauren's a member of their staff, but Danielle Yancey from NACHP and many of the other staff have been very, very helpful to us, not just in providing resources, honestly, to the Sokaogon and helping us facilitate this dialogue, but internally within the medical school to really help us be effective advocates and champions for partnering with our tribal governments. They really have been incredibly helpful to facilitate this dialogue. And, I really want to thank the Sokaogon Tribal Council for being so progressive in their thinking, really, and in welcoming us. And supporting this. So I think that those were the slides we had. Lauren, was there more you wanted to take from here, or?
Yeah, I just wanted to add in that the Native American Center for Health Professions, which was established in 2012, really focuses on supporting our Native American health professional students get to UW-Madison, get in the health professional program they want to be in, make sure that they have a great time there and graduate there so that they can go back and serve their tribal communities. So we do have some students from Sokaogon in various programs, as well as students from the other 11 federally recognized tribes Carla mentioned, and the one unrecognized tribe in the state of Wisconsin, who are in training programs such as our MD program, our PA program, etc. And our center really wants to promote health education, research, and community academic partnerships like this one. And to do that, there's a lot of different things that the center does, and it's a really great starting point if you are an internal member of UW to learn more about what it looks like to partner with tribes, as the center has been doing it for over a decade. And it was really great to have this partnership with the center because Sokaogon is really focused on advancing the health priorities of their people. So I think that is what I wanted to add there. I think the other thing that kind of touches on some questions in the chat is this idea that Sokaogon has been really invested in this partnership, which has been a huge honor. It's just like if the government of Sweden wanted to have a partnership with the university. It's been a huge honor to be able to have them invested in this partnership and advance the health of their people through research efforts with the university. So I think that kind of goes to Kayla's question. Are there other questions or thoughts people on the council had?
Jason and Caleb, I was wondering, could we back up just a tiny bit? And, when you first called, Kurt, what were kind of some of those health concerns that you were thinking about? What were you kind of thinking the UW could help your community with? And how have those discussions evolved over time?
So some of the initial conversations, as in the logo, right? The Wisconsin Biohealth Tech Hub, a pathway to personalized medicine, really made a statement to me, right? Like unserved areas, in medicine has been, the tribal nations, right? And me having a background in technology, right, and understanding, right, and reading, Tech Hub and talking about data center, right, talking about manufacturing, talking about bringing personalized medicine to tribal country, and how we can utilize technology as the gap, right, in a sense, bringing Madison to Forest County and to the Sokaogon Chippewa. And so some of those discussions obviously evolved, right? They started with how can we help and participate in this, right? Being the Sokaogon Nation, and then also advancing it to where, storing their data on the tribal reservation in the form of a data center. How can we bring the advancements in healthcare to their doorstep, utilizing technology? That was some of the aforementioned discussion points. And then obviously when you bring a lot of, smart and dedicated and striving people in a room, it expands, from there pretty rapidly, on looking at, clinical research, right? Looking at, how can we bring, education, right? Like, some of the courseware that, Madison has and is accredited for. How can we bring internships, right? Because there is a shortage up here in finding, RNs and pharmacy individuals and doctors, et cetera. How can we partner with the School of Medicine to create that environment to when they come up here, they feel like they're part of the family, right? And that is the framework which we're trying to utilize. And me selfishly, having technology, bridge that gap is really important here. But then, obviously the council has, their own stories and reasons for doing it. But again, to have a unanimous tribal council to support this initiative from this side is what I'll call unique.
Right.
Carla, could I add one thing?
Yeah, sure.
Just as it relates to the Tech Hub and to those projects and these discussions, one of the things that I think that Chairman Van Zyl made so clear to us on our first visit to Mole Lake when he was really framing out his vision for the well-being of the community is they wanted to be engaged in these discussions. They wanted to be represented in, one of our projects is a composite of health data statewide. They wanted to be represented, but they wanted to be represented in a way that respected their sovereignty. And I think that's been so important in our discussions. And again, that's something, the importance of this dialogue, but also understanding that we don't speak for the Sokaogon. We don't speak for them. It's about learning what they are comfortable with within that framework. And that's been so valuable and why these exchanges have been so important.
Right.
Yeah. There's, 574 tribes across the United States, and they make up what a state size would be the fourth largest state in the US. And so recognizing that their sovereignty in these discussions and their governance of how they want their health data collected, stored, used, and what that looks like from their end, so that the data that we're collecting in these research projects is honoring what their vision as a community is so important. And I think to one of the questions in the chat about traditional medicines, I would actually reframe that question, because you know, when we think about tribal communities in Wisconsin specifically, we're aware that there's things that they need for health services to better the health outcomes seen in their community. But you also have to recognize that their traditional medicines have been keeping them alive for a really, really long time in the face of a lot of adversities of being moved to places that are unfamiliar to them, of being cut off from resources that they are used to having. And from that, those traditional medicines and their medical practices have survived and empowered them to continue to live healthy lives. So I think it's really, how do we integrate what we do here at the university in our health systems and in our research to match what they are doing in their community regarding traditional medicine. So that's really the thought process there about how to involve traditional medicine in common healthcare practices, including things like billing and supplies and people's time, and honoring those processes that take place with traditional medicines.
I appreciate that, Dr. McLester-Davis. I think the other thing that's been really important about this relationship is that it's a relationship, right? So as Kurt mentioned, bringing a large group of, you know, PhDs and doctors and others, staff, faculty, to Mole Lake, which is very rural in northern Wisconsin, and spending days there, and getting on UTVs and eating traditional foods, and seeing the mining site and listening to the stories, seeing the canoes. I remember one of the first the first visit I was with you all. One of you told a story about building that canoe and how it contributed to the wellness of a tribal elder who was a veteran, and how that tribal veteran had rarely talked or came out of their house, but helping the community build that canoe got them moving and coming out of their house and sharing stories, and really all general wellness. So going back to that traditional practice of building that canoe, as Dr. McLester-Davis said, it's not just traditional plants and herbs and medicines, it's complete wellness, right? It's our traditional cultural practices that that the tribe has been sharing with people here at the university, that have opened eyes and have had opened a whole new world and way of thinking about things, that have really been important to this relationship building, and way of thinking about approaching ways to addressing community issues. I think we have a few more minutes. So this looks like there's a question about bringing more students to rural communities. I know NACHP, as you mentioned, does bring students to tribal communities, and it's not just Native students, right? Is that true, Dr. McLester-Davis? Could you talk a little bit about that?
Yeah, that's right. So our center partners with tribal health clinics to create learning opportunities for students during their training here at UW. So a lot of students have the opportunity to do clinic rotations, regardless of if they're a Native student here at UW or not. We also create opportunities if any tribal high school students are interested in doing shadowing at the clinic with Native providers, also creating that opportunity so that they get engaged in health careers really early on. We have in April coming up our annual Indigenous Health and Wellness Day event for students who are in middle school, mostly high school, who come to UW to experience what it would be like to be here at the college and what that looks like from tribal communities. So I think Sokaogon is planning on coming up for that event happening in April with the center, but various ways that our center really partners with tribal health clinics to create more opportunities for medical students, physician assistants, various other health careers to be brought into those communities to see what it really looks like to work at a tribal health clinic, with the goal of really supporting individuals working in those health clinics. With that new expansion, Sokaogon they'll need a couple more providers to be able to fill in there. So we look forward to partnering with them on that as well.
That's good news. I'm going to give the last question to Councilman McGeshick and Jason. So someone wants to know, what are you looking forward to in the next few months when it comes to this partnership?
It's a great question, Jason. Would you like to start?
Sure. I think that one of the things is the focus on the technology, right? Like creating that direct connect, utilizing technology with UW-Madison in directly to the clinic and to the tribal offices. I think that I'm excited about that, because once you have that, right, the ability to remove the distance between, it's a 3.5 hour, 4 hour ride between Madison and Mole Lake. And utilizing technology to lessen that distance, I think, is going to be hugely impactful to move this relationship forward even further, right? Utilizing and working with, Dr. Lauren and Carla and Kurt, and the wealth of information and the wealth of people that they know in the industry is really critical. And again, utilizing technology to bridge that gap is really exciting, and some of the things that are on the forefront for me.
Well, thank you. And thank you again. And we really appreciate it. And I'm looking forward to coming up there again soon, and some delicious fish. And you might get me on that UTV again. I don't know. We'll see. Kind of scared me the last time. I'm going to give one last little piece of information before I kick it back to Jorge. I would be remiss without telling people that UW-Madison provides Native students who are enrolled members of federally recognized tribes of Wisconsin the full cost of attendance, undergraduate students, the full cost of attendance. It's called the Wisconsin Tribal Educational Promise Program to attend here at UW-Madison. And so we would, encourage you to look into that if you know any Native students who are interested in attending UW-Madison. And for those who are looking into going to medical school, we do have a pilot program for tuition. And so you would get to spend a lot of good time with Dr. McLester-Davis and her colleagues over at NACHP. They do provide tuition for, again, those who are members of federally recognized Wisconsin Native Nations. So I would be remiss if I didn't mention that. And with that, I will kick it back to Jorge.
Well, Carla, thank you so much. And I think this was such a wonderful webinar. I really want to thank you all for joining the webinar. Thank you to all the speakers. It was such a wonderful discussion. And also I want to thank all the participants, the people that joined the webinar. It was quite nice to have such a great discussion. With that, I'd like to finish just to let you know that we will have another webinar on February 25th, and it will be about women in science, discussing women in science, which we are very excited about this, so please stay tuned. And so make sure that you visit our website at ghi.wisc.edu to learn more about the ongoing activities that we have, and also archive videos. And I hope everybody has a wonderful day. And once again, thank you, Carla, and all the speakers for such a wonderful webinar. Have a wonderful day.
Thank you too. Thank you.